Revolution Radio proudly presents, live from the heart of the Blue Ridge, Roanoke, Virginia. It's the Just Bernard Show with host Bernard Alvarez. Join Bernard as he shares topics that reveal the real matrix and empower your human experience, including world liberty, the esoteric, suppressed technologies, spiritual ascension, and human consciousness. Humanity has awakened, and our time has come to realize our full potential. And now, live from the Star City, your host, Bernard Alvarez.
Today, we are going to be speaking about naturopathic healing versus allopathic healing. My guest today is Dr. Wil Spencer. He is a naturopath, a VMSP author, and researcher. He is an advocate for nature. His work extends into multiple areas of investigative research and education regarding human and environmental health relative to identifying and restoring the degraded conditions of natural homeostasis that is most often due to industrialization and the misunderstanding of the importance of microorganisms. Thank you so much for joining us today, Dr. Wil. How are you?
Not too bad. I'm really good.
Oh, good. I'm glad somebody is. No, I'm glad. I'm very happy to have you here. And Wil, how have you been? How's the practice going? How's the radio show going?
Well, our stuff is going good here. In my own personal bit of evolution here, I figure if we're comfortable, there's something wrong. So I have my own internal things where I'm learning to have workability in my life and get rid of my old programs, if you will, that don't work in my life. So I'm feeling on that level, on the personal level, a little bit into meat grinder, because the altering my already always programs sometimes are very challenging.
Yes. And it's so funny you brought that up. For those of you that don't know, later tonight I'm going to be launching a seminar series called The Awakening Code, and that happens to be one of the main topics I'm covering. Getting rid of our, even if it's positive programming, but identifying and knowing that it's programming and being able to alter that and not getting stuck, in our story. Is that kind of what you're talking about?
Oh, yeah, that's exactly what. Yes.
Okay, very good. Well, we're definitely on the same vibe when it comes to that. So, Wil, let's start off. If you can just give us a brief overview of what you see the main differences between naturopathic and allopathic medicine, and perhaps maybe define it better so our listeners can understand what the words actually mean.
Well, I'm coming into a new understanding of the naturopathic side as well. But originally, the allopathic medicine is your American Medical Association licensed practitioners that are bound to only using FDA, the Food and Drug Administration, legalized, recognized forms of therapies, treatments, drugs, medicines, procedures. Okay, that's your Western medical allopathic model.
Right.
Okay, and then your option, or the other alternative, it would be then your naturopathic view of health, where you're considered a natural being, and then we're using natural substances to help improve your health. So natural meaning basically non-FDA approved procedures, modalities, supplements, and where we're looking more for the using food, nutrition, nutrients, elements that are natural, created like hunting herbs, using herbs, herbology, homeopathy, and a lot of the energy medicine realm modalities, all in the naturopathic world. Okay, so there's your two worlds.
Yeah.
And what I'm seeing is that there's some similarities in both worlds. They're still based in a way of thinking that, oh, I have a problem with my nose, my stuffed up nose, so we need to fix that problem. Both realms go at it that way, and we're taught that way. If you naturopathic school as well as allopathic school, that's the line of thinking.
Right.
Well, over time, doing this, and I'm developing, me personally, here at bodyelectrician.com, we're developing a new view, and that is there's something deeper of why that nose is stuffed up or why we're having upper respiratory problems. There's this new direction developing, even in allopathic. And so addressing the symptoms is now becoming much deeper. It has more depth because we're able now, with identification of some of these new studies, actually this is coming out of academia, in the childhood adversity study, which is called your ACEs study, Adverse Childhood Adversity Study. It was within 2 years, it just come to a completion. So now there's this new bit of information where it's taking things to this other level where, okay, so I have a lung problem and an allergy problem, and what the new information is saying that the lung and the infection in the lung isn't the problem anymore where it used to be. It's actually now much deep-seated, much more it goes back further.
Right. Okay.
It goes back further to childhood. So I know I had adversity in childhood. I grew up in basically a smiling war zone where I didn't know when the next slap was going to come from or the next beating was going to come from. And so I was very uneasy. And so now they're making a distinct correlation between what happened as a child or what happened to your mom while you were in gestation to now being 50 years old and having a nervous breakdown, having allergies all of a sudden, having diabetes, so there's
Wow.
a much bigger picture developing over here in the natural world based on some of the information coming out of the allopathic world. And a lot of these strategies to handle these are pretty much all in the natural world, because they're natural things. They're not just talk therapy and drugs.
Right.
Okay, so it's beginning to see this bigger picture, and I knew this. I mean, was warned in 1978 as a young guy that allopathic medicine, that line of thinking, is going to be duplicated over in the natural health world, and that's pretty much where we're at today.
Oh, wow.
The naturopathic thinking, because if you go to any naturopathic school in this country, they're teaching you basically looking at diseases and illnesses with the same mindset as allopathic viewpoints, just using different things to address them.
Okay. So what you're saying, as far as, let's say, the lung tumor or whatnot being affected by something that happened in our past, in metaphysics we kind of call that like energy memory. Is that kind of where naturopathy it's realizing that our body has energetic memory as well, or DNA memory, for lack of a better term?
I'm not sure if I understand and I'm aligned with what you just said.
Right.
I'm not sure if the whole entire naturopathic view is of that, because
Okay.
this naturopathic view in my book is still evolving.
Right.
Okay, because I'm aware of that, and that's the direction that I personally address things. It's not just we have a lung problem, but we have like a grief problem from a long time ago. I mean, I get that. So, but I'm not sure if the whole entire naturopathic world gets that, because they're not teaching that in most of the schools yet. That's still relatively new information, as in getting it out to the masses of people.
I see. And, as I was researching this particular topic of allopathy versus naturopathy, I was very, I don't want to, well, pleasantly surprised is a good term to use, that according to several articles that I was reading, I mean, naturopathy seems to encompass everything that we would call alternative medicine, from acupuncture to Ayurveda to, like you said, energy healing, nutrition, all of these things. Is that fair to say that we can kind of use those words interchangeably, alternative and naturopathy.
Yeah, to some extent.
Okay.
I mean, I pick it apart a little bit because we're stuck. It's like you go to the medical world, they're great at triage and handling emergencies.
Right.
Okay. They're good at that. Very good. It's like in a war, you've got your medics and they can stabilize you. But then beyond that, in the medical allopathic world, there's not a whole lot of workability there because they're all about identifying the problem and fixing that particular problem. Okay. And the naturopathic world kind of operates that way, but yet we're very limited in what we're going by classical naturopathy training. It's fairly limited because most emergencies require medical triage type of care.
Yeah.
You know what I'm saying?
Yeah,
so
yeah.
There's not a lot of focus in real prevention, even in the natural health world.
I see.
That's my opinion.
Right.
You're hearing my opinion, and my opinion, in my opinion, is different than most. And I'm seeing the naturopathic. There's actually several different divisions and slots inside of that as well.
And speaking of divisions and slots and specialties, I guess. Will, what is your specialty considered? What do you specialize in naturopathy?
And see there, we're my partner and I and our business, we're developing that because there is nobody in the naturopathy that addresses things the way we do.
Okay.
Like those products that I sent you.
Mm-hmm.
Okay. Those are my formulas. I developed those, and we have over 500 strains of probiotics. There's nobody on the market that has the diversity of just the products, just those alone that we use.
Wow.
Okay, so we're defining things, in a naturopathic world, based on criteria and views that are extremely limited. And we're finding that I don't do anything. Basically, I don't address people and situations the way I was taught in school.
Oh, okay.
We've migrated away from that with the technology that we're using now. It's a completely altered way of looking at things because we're able to look at not only the physical, let's just say infections, if you will, which we're able now with some technology to identify over 2,000 strains of potentially infectious microorganisms and parasites.
Wow.
Where in the allopathic world and the rest of the bulk of the naturopathic world, they don't have that ability yet for the most part, or they're not using it yet. Okay, and we're also able to see inside the body with our little bit of technology that we can determine what belief systems that you're holding on to that are negatively impacting your health or keeping you from real health. I mean, vibrant health.
That's fascinating. That's really interesting. And I actually wanted to go a little bit deeper into that because I find that, I find that very, very fascinating. On your site, you have something called the Galvanic skin response process. And is this what you're talking about, where you kind of get the main overview of what's going on in somebody's body?
Yes, and that technology, just to share a little bit, was developed in 1924.
Oh, wow.
And last month, 2016, first month, January, the FDA recognized that it's even valid.
Huh. Wow.
So do you want to know how slow the wheels turn in this world? We're talking, 80 years or 90 years, actually, that it took the medical model, the allopathic medical model, to even accept that it's real, first of all.
Right.
And it's been around, used in so many different applications. And some of the applications in the medical model use this similar technology or offshoots of this technology. Like anything that touches the skin to get a reading is galvanic skin response.
Right.
Literally, our skin is attached to everything in our body. We are a walking electromagnetic generator.
Yeah.
And with just touching your skin, you can see and figure things out throughout your entire body, no matter where you touch the skin. Okay, and that's a bit of the technology. That's really taking over this kind of technology, and it's really helping us to help people faster, because you can do muscle testing, and I liken the galvanic skin response to muscle testing, because in my mind it's the same. It's only like 1,000 times faster, and it's way more accurate, because when you do muscle testing, which you're familiar with muscle testing, right, Bernard? Yeah. Okay, so there's 5 different kinds of kinesiology, which is muscle testing, and nobody really knows that there's 5 different kinds. I'm trained in 3, and it's basically all the same. The technology uses your body muscles to get answers. So you're having to ask the question and then get a response. Well, this galvanic skin response does exactly the same thing, but you don't have to move a muscle, and it talks to your body where you're at. Just picture this. I'm going to ask you a question. What is your name? Okay, you got to think about it.
Right.
Then you're going to go, okay, let's test the muscle. That took what? 8-10 seconds.
Yeah.
Okay. Well, in the galvanic skin response, the technology that we're using, we can ask 2 questions per second and get a response, and the software calculates what's going on in a half a second per question.
Wow.
The technology has taken basically a 4 to 5 hour process down to less than 30 minutes. And my experience and observation is it is extremely accurate. Where when you're muscle testing, because of your ego, you can then get skewed answers if you're not skilled in asking specific questions, because now you got your ego involved.
Yeah.
And that's dangerous.
So you're circumventing the ego by using this, or in a way.
It is. It's totally taking you out of your conscious reality and talking directly to your subconscious mind, where all the stuff is stored. Yeah, I think it is.
Absolutely. Is it fair to say now, unfortunately, I've been seeing doctors now for the last 3 months quite regularly. And, their big thing is always, oh, well, let's do a CAT scan, and then we'll figure out where to go from here. Is it fair to say this is your healthy version of a CAT scan to get an overview of the body?
Yes, this is not only our version of the CAT scan, but it's our version of the blood test, the pH test, the microorganism infection test. This is tissue culture. This is blood culturing. This is your you name whatever testing method is in the allopathic world and the bulk of the naturopathic world. And then this has pretty much taken away everything. I don't look through the microscope hardly anymore. I don't look through the slit scope anymore. I don't send in hair samples anymore. I don't do blood samples. Nothing. I don't do any of that other testing at all, because this has replaced all of that.
That's amazing.
And it's more accurate, and it's cheaper, and it's faster.
So give me an example, Will, of how you could utilize this in treating somebody. Let's say somebody who has, shingles. Would that show up and say where the shingles is coming from, or?
If you have shingles, an active shingle virus, if you have 2 cells of shingle virus that are stressing you to whatever degree, we'll be able to see it. And let's just say it's in your, on the back of your shoulders, and it's affecting some of your muscles. We'll be able to see which vertebrae are affected. We'll be able to see which meridians are affected. We'll be able to see which area of your body it's affecting, if in fact it is stressing you. Okay, so feeling pain and if it's actually stressing you subconsciously is 2 completely separate realities, just to let you know. Because feeling pain is actually the way the body is dealing with something. And it might not even be stressing you on that subconscious level, but you are in abject pain. So there's a separation there we're able to see and identify.
On an energetic level, so to speak.
On a total energetic level.
Wow. It's funny. I was just mentioning to Treva before the show, and it just rang home with me what you just said. Allopathic. I'm taking allopathic painkillers right now, and she asked me, she's like, "Are you in pain?" I'm like, "Yeah, I'm in pain, but I feel good because the painkiller made me feel good, but I still feel the pain." And
right.
It kind of goes with the opposite of what you're saying,
Yes, exactly.
crazy, absolutely crazy. Now, going on with this galvanic skin response process, um, is this? And I know you kind of answered it, but can you, let's say, go back in 2 weeks and use it again to see how somebody's doing, or is this like a one-time deal? What? How do you utilize it for follow-up?
It's designed to be most effective as a continual process every month, 2 months,
Oh,
3 months, as in this is the best prevention I've ever seen. We're able to identify, just for instance, we had somebody come recently with a kidney problem. All right. And we were able to see that it was actually not the kidney itself that was the problem, but this person was in a very fearful, emotionally unstable situation, full of fear, like scared for my life. I'm going to lose my job, and then I'm going to, end up getting divorced, and, had all this fear. Well, like Louise Hayes has been saying for a long, long time, well, where is fear held? It's held in our kidneys.
oh,
Well, we were able to pick up on the energetic level that there was a huge amount of fear that this person was dealing with, and it was actually physically feeling painful in the kidney area, but the pain was on the energetic level, emotional level, and it wasn't the physical kidney level, the not the biological level. So we're able to see see the illness before it turns to physical. And in a preventative method or in a preventative mindset, this works extremely well, better that way than it does. I have a problem. Let's fix let's go into the after, using it. Like first time users come to us, I have all these lists of problems. Well, it works better as a prevention, but it still works really well as coming to us the first time with a bunch of problems.
that's oh man, that's awesome. That's great. We're about to come up on a commercial break, so I don't want to jump into a deep topic right now. So let me just let everybody know that if you are interested in learning more about Dr. Wil Spencer and the work that he's doing, please go to bodyelectrician.com. He's got wonderful, wonderful products there as well if you're interested in getting any treatment.
And now, back to your host, Bernard Alvarez.
And welcome back to the Just Bernard Show here on Revolution Radio at freedomslips.com. Before we continue with our conversation, I just want to remind everybody I am very, very proud and very happy tonight to be sharing with the world the beginning of my new seminar series called The Awakening Code. If you are interested in participating in the series, you can go to bernardalvarez.com, scroll down a little bit, and you'll see all the information there, and click on it for more info. I'm trying something new. I don't know how many people are doing this already, but I want to make this series as interactive as possible. You'll have the ability to ask questions live during the seminar. You'll even be able to join me live on camera if you want to show your face on camera with me. This is going to be very interactive, and I hope that this is the beginning of a wonderful way of sharing information that I have to offer with the world consistently. I hope to be doing this every month. Anyway, let's welcome back Dr. Wil Spencer to today's show. Now, Wil, we talked a little bit about this before the show, a little bit about the difference of allopath and naturopath. In allopathic medicine, the food we eat, toxins we ingest, poisons we use on our lawns and home are unimportant. Air, water are not relevant to health issues. Natural food is just a fad. Food supplements are not necessary and might be harmful. Patients don't need vitamins and minerals. I'm sure there's a sharp contrast with naturopath. How do you approach the statement, and how do you see all of the environmental factors that affect our health?
Well, I approach the statement by looking at definitions where they're coming from, because in allopathic medicine, everything is based on clinical settings, laboratory settings, clinical informations, clinical studies, clinical observation. And so I had this epiphany a few years ago. It's like, oh, we don't live in a clinic. Because if you understand what a clinic setting is, it is controlled. They like to think that it's sterile, and everything has to do with that viewpoint. It's about the viewpoint of something in a petri dish in a clinical setting. And unfortunately, we're not a petri dish in a clinical setting. We are human beings. We are flesh and blood, and we are out in a natural world. Well, you want to call it natural world, but we're not in that clinical, completely sterile type of environment, but yet all the information in allopathic and the bulk of the naturopathic thinking is coming from that clinical type of thinking, where clinical. Okay, so just looking at that, the internal combustion engine is where the thought is you have your fuel source, you put it in the tank, and your engine runs. To me, that is how allopathic looks at it. They don't take into consideration the kind of air that's going in, or the kind of water, or the different elements and levels of elements that we're consuming, just like you mentioned prior. So that I liken the allopathic thinking and to that clinical setting, like addressing the body as an internal combustion engine only, and not taking into consideration there's a humanity, a soul in there, and there's a lot more diverse things happening simultaneously as just the engine running, like just in the body. So you have energetic aspects to what we're eating or what we're doing as well. So in the natural world, they're more open to the alternatives, like air quality, food quality, element quality, water quality. The quality of the elements, that comes into play huge for me personally, as well as the naturopathic world considers that to be important as well.
I can't help but think about, I think I did a video a few years ago, and I kind of had an epiphany in the middle of it. And I believe I was talking about like fluoride and, your third eye and whatnot. And it made me realize how unaware, I mean, literally, we are unaware of what we are putting into our body, not only in the food that we eat and the ingredients that are in the food and the drinks that we drink. But in reference to fluoride, I was talking about, our shower, the water that we bathe in, that water is absorbed into our body. The air that we breathe outside, we don't think about our breath and what we're putting into our body. And then energetic and emotionally, the things and the people that we surround ourselves with, are they making us feel bad? Are they making us feel bad about ourselves? So much that we're not even aware of. And I guess, for lack of a better term, what you're describing, to be aware of all these things is kind of a naturopathic way of looking at the world, and a complete way of looking at the world.
It's definitely a more holistic view of how we're looking at the world. And so when everything comes into play, it makes things a little more complicated in one fashion, because you have so many contributing factors to what can be going wrong. And this is why I get people frustrated a lot, because they ask a simple question. Like, what do you think's causing my infection?
Right.
Like, well, the simple answer is the microorganisms is causing the infection, or the chemicals are there. And now I can, I turn that into almost a half an hour to an hour conversation, because, now we have all this other stuff to talk about. Okay, emotions. Are you scared? Have you been scared lately? Has your life taken a turn to the, to the fear or to the anxiety? So it's taken. It's evolving into a much bigger conversation than, oh, you have a lung problem. Boy, let's either kill the infection or let's just cut the lung out. We don't need it. We have another one. It's evolving past that. And I think this is where the world is going. We're evolving. We've passed 80 years past allopathic medicine. It's not even relevant really, unless you're like in a severe life challenging or life-threatening event. Otherwise, allopathic medicine has really no relevance anymore, because you can't be healthy if you're following allopathic ways. It's impossible.
And you know, and just like you said, the only thing I see it good for is uh, I'm sure there's more reasons, but the main thing I would use it for, and I do use it for, is for emergency medical care. I mean, you know, I had an appendix burst. I had to go to a doctor and have someone cut it out. But beyond that, as far as the whole treatment afterward, and I'm having very difficult issues with regaining my health after that, and they don't seem to know exactly what's going on and whatnot. But beyond that, I have to ask. Um, Environmental factors, and this was something that hit me the other day, not only on a spiritual level, on an emotional level, but on a physical level, how different the world is today, environmentally speaking, as let's say 20 years ago. Now with we have so many satellites out there, we have so many Wi-Fi towers, and have you come across anything that has shown that this is affecting somebody's health in any way?
The environmental impacts on our health is extremely negative right now, for the most part.
Wow.
I can say, if you following what we're doing in our protocols and things, you can still exist, even though exist relatively well, and these things don't harm you, like the EMF problem, like the pollution problem, like the over 25 different biological warfare agents that are just commonly in our environment now, the over 100 different strains of Lyme bacteria, and now we're finding virus infections associated with Lyme disease. So we have it on all these levels. Not, we haven't even talked about the genetically modified conversation about what's going on that level.
Oh yeah.
So we have this huge assault, basically, and I look at it as an assault because it's coming from the view of allopathic, that view of allopathic or academy. All right. Academic information and allopathic are pretty much aligned in thinking that the body is an internal combustion engine and really nothing is going to alter that. And if you have, if you start having a knock in cylinder number 4 in my diesel engine, well, you can identify the cylinder knock. You can go in and replace the bearing, and boom, the cylinder knock, the noise is gone, and you're back up running again. But see, our bodies aren't like that. But yet, academia and allopathic is still holding on to the concept that we're diesel combustion engines,
Right.
when it's not real.
And of course, it's all for profit. If you throw that into that, it gets even more predatory.
Yeah, you get that whole conversation. Exactly. So, and in the natural health world, for the most part, they're thinking the same way because you're taught as a naturopath that same allopathic line of thinking, except using natural substances. But your thinking really, for the most part, isn't upgraded past we're still living in this meat suit that's really like a combustion engine.
Mm. And so, Will, to kind of change the conversation a little bit, I'm wondering, in your experience, and I guess I'm doing this for the benefit of our listeners, what is the main, I don't want to say the main disease or illness, but what is the main imbalance, I guess, that you see, and what would you recommend as a basics for bringing greater alignment with our natural body?
Oh boy.
If you had to pick one or two.
Well, we can step back from the picture and look at it pretty broad, and it's really the view of ourself, the perception of ourself in our world. If you want to go back past the physical,
Okay.
because the physical is, there's so many things going on physically with people for illnesses. There's no one.
Right.
I mean, and I have calculated a little bit, and there's not one really any more than the other, really.
Oh, okay.
We have infections we're dealing with. We have toxins we're all dealing with. We have malnutrition we're all dealing with. But the biggest thing is who we are in our world, or our perception of our world. That, for most, I see, is one of the biggest negative contributing factors to the illness, is because we're not clear of who we really are. And we're not happy with ourselves, or we're not really empowered, if you will.
Yeah.
That seems to be the biggest illness.
I can't help but agree with you. That's exactly what I feel, and that's why I do the work that I do. We have the skewed idea of, the skewed acceptance of being a victim of the world around us. And I find that if once we step into our power, we change the way that we see ourselves and our role in this world. And perhaps we're going to gain a greater a balance of our energetic field and thus creating a healthier body.
Exactly that viewpoint. And when people come to us, I'm sick, fix me.
Mm-hmm.
And I cause a lot of frustration for people, but I'm saying, but you live in there. We can provide you with the tools. I can't put them down your throat for you. And there's no way that I can meditate for you. There's no way that I can self-love you, because I can't do that.
Mm-hmm.
It's about you're responsible for yourself. And the whole idea with allopathic medicine is you have a problem, come let me fix it, just like the car breaks down and you take it to the mechanic to get the car fixed. It's the same model in allopathic thinking. And we're altering that. We do more counseling and more self-empowerment with people, because that's really where the illness started, was in the energy layer, if you will, the energy realm. There's always that disruption first before there's anything ever physical.
Absolutely. And that brings me to the idea that we have, for lack of a better term, a bit of toxicity within our energy or within our emotional body. And we have to remove that as well as in our physical body. And I'm sure we have, I'm sure you could tell us quite a bit about detoxifying the physical form. But, how do we go about detoxifying the emotional body?
Well, it's letting go. And there's so many different things out there, and I've explored several of them. One thing that has helped me the most is the landmark education.
Oh yeah, been there.
That among anything else has helped me. I went through the 3 levels a few years ago,
Mm-hmm.
and though that year for me was monumental, because I made the association of how I sabotage myself
Mm-hmm.
and how I view myself in my world. When I altered that, I dropped 20 pounds, literally. I mean, I didn't do anything different other than that. I dropped 20 pounds, and my communication with other people began to develop to be more clearer. Because if you listen to some of my interviews on the internet 5-6 years ago versus today, I'm not this. I go back and listen. I'm going, how could people even listen to that guy?
Right. It's very scary. Will, you're scaring me. I went through the same. Well, I went through the form. I went through level 1, and it was about that time when I changed my life, or the universe changed it, and brought me into doing the work I'm doing now. And yeah, I really love the no nonsense practicality of their philosophy. I don't know if what your form was like, but I remember the first level, which I did, the 3 days at the beginning of the form. They said, at the end of this form, we are going to reveal to you the meaning of life. And here we are, the last day, and we're like, oh, well, you said you're going to tell us what the meaning of life is. And they said, well, the reality of it is the meaning of life is that life has no meaning.
Exactly.
It is what you make it.
Yeah.
I was like,
Yeah.
That's great. Thank you. I needed to hear that.
And if we live like I create my reality based on my free will choices, and most people like me, before that concept, I was making my choices without my free will, because
Yes.
I was doing it out of carrying all my baggage around and all this negative, all my perceptions and my meaning making machine, where I mean, like, you're attacking me just because you looked at me funny, instead of going, oh, wow, I wonder if they're having a bad day because they're not looking at me very good, instead of making, oh my God, when I was 3, my mom used to look at me like that. And then right before she beat me.
Right.
And
It's
when
reactive. It's that reactive nature within us.
Yes, exactly. And when you can start to separate and distinguish the differences and why I'm thinking this way, and I'm not being harmed. I'm just here today in this moment. The past is all gone, and that's one of my struggles right now is I have lived a certain way, and that is basically aware of where all the landmines are and learning where the landmines are. So now I've really having to refer back to my past all the time. I've actually degraded a little bit because I was unaware that could creep back into my life like it has.
God, it's so funny you mentioned that. I feel like so many of us on this, well, for lack of a better term, spiritual, holistic awakening path are going through very similar things. A lot of that old stuff seems to be coming up. And I think that's a good thing, even though it's painful. And yeah, we do go backward a little bit. It's, again, detoxifying.
It's detoxifying. There was a video on the internet somebody sent me that it was this older fellow with this big white beard, and he was talking about a lobster. A lobster is a hard-shelled animal, but his body is soft and it's inside of the shell. And as he grows, he gets to the uncomfortable point of outgrowing his shell, but his shell is pretty solid. So he actually has to go down in under the floor in the mud and the rocks or whatever, squeeze out of his shell, grow another one that's a little bit bigger, and then he's comfortable for a while, and then he gets uncomfortable. He cannot grow unless he gets uncomfortable first.
Yeah.
That was so profound for me. Because I'm in this process right now, and I feel extremely emotionally uncomfortable and uneasy. And I can just relax, and I just have to drop my shell, drop my boundaries and barriers, and drop all my protection mechanisms, and then I can grow and I can continue to grow again.
Absolutely. And it's a part of the process, like you said, and a very common one. And I feel there's a certain courage that's involved in that as well.
It's a huge courage because you're facing yourself. And we're taught not to. We're taught to shun ourselves, and we're taught to look outward. And really, all the sages of the past have always said we need to go inward, and that is where health begins, and that is where we are. We are in here, inside.
Absolutely. It's and of course in allopathic medicine or pharmaceutical medicine, they give you a pill so you don't have to look inside.
Right, like the insides are the enemy over in allopathic. And I'm so happy the naturopathic world is starting to see that the old sages of the earth medicines that have been around for thousands and thousands of years, they're becoming more aware of it. And because that's where the value for health is with the old ways of health.
Yes, it is. Very, very true. We're about to run out of time. I can't believe how quickly this hour has gone by. So, Wil, let me ask you again, let's say you were giving someone a starter nutritional supplement pack. What are some of the main things that people would want to take every day to make sure they take every day?
Minerals and probiotics meaning the full spectrum. I mean, you can buy them at the store, but there's also a whole other world of non-colonizers that we deal with, 500 strains. And so minerals, we're all mineral deficient, and we all need probiotics or microorganisms because that's 80% of our immunity.
Yeah, it is. I'm living it right now. I know. The idea, what about multivitamins? Are they helpful? Should we bother?
I don't really encourage people to take vitamins because the body's supposed to be making the vitamins, every vitamin we ever need, and there's over 30 different vitamins. And so our goal, anyhow, for me, is to get the body to start creating them themselves rather than taking them synthetically. It's taking them, that are made in a factory.
Yeah, exactly. Going natural and letting the body create it. Wonderful.
Yes.
Well, thank you for that. Wil, tell us about your show here on Revolution Radio. We got about a minute left. What day is it on? What time is it on? I think you're on at the same time, 2:00, right?
I am, 2 Eastern time, and it's on Wednesday afternoons. It's called An Alternate Perspective with Dr. Wil, and I have guests on just like you do.
Wonderful. Great. Well, thank you so much for joining us today, Dr. Wil Spencer. I really appreciate it.
You're welcome, Bernard. Thank you.
Thank you. And everybody, we will see you next week. We love you.